Have you ever stopped to think that the vitamins you take daily could be harmful to your health? It might sound strange, but it's true. In this Dose of Health video, we'll learn about a story that shows how something as common as a vitamin can cause serious problems. The case of a 55-year-old woman. Imagine a 55-year-old woman who believed she was taking good care of her health by taking vitamins every day. It was December 2012, and suddenly she started feeling very ill. She became so weak that she had to go to the emergency room. Doctors were concerned because she had kidney disease, and it seemed her condition had worsened. When they examined her, they found alarming situations. Her heart was beating very slowly, her body temperature was very low, around 34 degrees Celsius, 93.2 degrees Fahrenheit, and her body was swollen. Doctors suspected that her kidney problem had worsened, so they performed a test to evaluate her kidneys. The results were shocking. Her blood creatinine levels, which were normal months before, had risen to an alarming value of 3,530 milligrams per deciliter. This indicated that her kidneys had stopped functioning properly. Her body could no longer eliminate waste, and she was no longer urinating. The situation was critical. Quickly, doctors transferred her to the intensive care unit and began using a machine to filter her blood, as her kidneys could not do it. But how did her kidneys worsen so quickly? The surprising diagnosis, after many tests, was discovered. The cause of the problem was not a new disease or a worsening of her pre-existing kidney disease. The culprit was something she believed was helping her health, a vitamin supplement. This story teaches us something important. It's common to think that vitamins are always safe because they don't require a prescription. However, this idea can be misleading, as the inadequate or excessive use of vitamins can pose significant health risks. In some cases, they can be even more dangerous than prescribed medications, especially for people with specific health conditions, such as kidney, liver, or cardiovascular diseases. The case of this woman is not unique. More and more people end up in the hospital due to problems caused by vitamins. A recent example is that of a young woman who recorded videos for TikTok. She developed kidney stones from taking too many vitamins to try to boost her immune system. Another case was that of a 61-year-old man who experienced severe pain. Initially, doctors thought the problem was with his pancreas, but later they discovered that the vitamins he was taking were responsible. There was also the story of someone who, by ingesting excessive amounts of vitamins, started vomiting constantly, had severe leg cramps, and lost 13 kilograms, 28.6 pounds, in just 1 month. This also caused kidney damage. These stories show how essential it is to know the supplements we consume well. It's important to know the correct doses and the risks of overdoing it. People with kidney disease need to be even more cautious, as when the kidneys don't function well, they can't eliminate excess vitamins from the body. This can lead to serious problems. So, what can we learn from all this? 1. Be careful with any type of supplement, including vitamins. 2. If you have any health problems, especially kidney issues, talk to your doctor before starting to take vitamins or supplements. Now, let's talk about 5 vitamins that can be risky if used improperly. Some can be harmful in excessive doses or when consumed in the wrong form, while others are particularly dangerous for people with kidney problems. We'll start with the least dangerous and move to the most risky. At the end of our list, we'll reveal which vitamin destroyed the woman's kidneys in our story. Number 1. Vitamin D. Vitamin D is essential for health, especially for the kidneys. However, you need to be careful with the amount consumed. This vitamin is fat-soluble, meaning it is stored in the body's fat. If there is an excess, it can cause problems such as elevated phosphate and calcium levels in the blood. This might seem harmless, but it can lead to serious complications, such as hardening of the arteries and, in extreme cases, acute kidney damage. Avoiding these problems is simple. Don't overdo it, and seek medical advice before supplementing with vitamin D or any other nutrient. Consuming vitamin D in small amounts is ideal for most people. A safe dose is about 2,000 international units, IU, per day. It's even better to combine it with 100 milligrams of vitamin K2 and a dose of magnesium. This combination helps prevent artery hardening and keeps vitamin D levels in balance. If you know someone with chronic kidney disease, sharing this information can be extremely useful. It can be scary to discover that vitamins necessary for health can also be dangerous, but it's better to be informed than to face serious problems like kidney failure. Number 2. Vitamin E. Another widely used vitamin that can cause serious health problems is vitamin E, especially in its synthetic form, called alpha-tocopherol. Studies show that this version can increase blood pressure, raise the risk of stroke or cancer, weaken bones, increase cholesterol levels, and damage the kidneys. Despite the known risks, alpha-tocopherol continues to be used in many products, including pills, powders for drinks, and processed foods. Studies conducted for people with kidney disease show that this synthetic form can be extremely dangerous. Natural vitamin E, on the other hand, has significant benefits. It is an antioxidant, which means it helps protect cells from damage. Antioxidants are especially important for managing and treating kidney diseases. However, it is not advisable to take vitamin E supplements without medical advice, especially the synthetic version. Excessive use can worsen kidney problems and bring other health risks. This information shows the importance of understanding the vitamins we consume. While they can offer essential benefits, their incorrect use can cause serious damage, especially for those who already have health problems. Always consult your doctor before starting any vitamin supplement, and remember to opt for natural and safe forms when necessary. If you want to obtain vitamin E safely, the best option is to include foods rich in this nutrient in your diet. Sunflower seeds, for example, are an excellent choice. Just 30 g of these seeds provide about 66% of the daily vitamin E requirement. This demonstrates how it is possible to obtain this vitamin from natural and healthy sources. Although natural vitamin E has many benefits, its synthetic version, called alpha-tocopherol, can be dangerous, especially for people with kidney problems. It is important to avoid supplements that contain high concentrations of this synthetic ingredient. Always consult a doctor before taking any vitamin E supplement, especially if you have a health condition like chronic kidney disease. Number 3. Vitamin B12. Another vitamin that requires special attention, especially in its synthetic form, is vitamin B12, specifically the type called cyanocobalamin. Unlike the natural form, known as methylcobalamin, cyanocobalamin is industrially produced because it is cheaper. It is present in many multivitamins and is widely consumed, but it can be risky, especially for people with chronic kidney disease. Why can cyanocobalamin be dangerous? Cyanocobalamin contains small amounts of cyanide. Although this is not a problem for healthy people, who can eliminate these small doses from the body, it is different for those with chronic kidney disease. Since the kidneys of these people do not function well, cyanide can accumulate in the body, worsening kidney problems. Studies show that ingesting large amounts of cyanocobalamin can lead to small productions of cyanide. This is not concerning for most people, but it can be harmful to those with weakened kidneys. Therefore, people with chronic kidney disease should opt for methylcobalamin, which is safer for the body in these conditions. If you need to supplement vitamin B12, especially in diets without animal products, doctors generally recommend about 16 micrograms of methylcobalamin per day. This amount is safe for most people. An important point about vitamin B12 is that our body does not absorb it very well. Therefore, many supplements contain extremely high doses, sometimes 100 times higher than the daily requirement. This is to ensure that the body absorbs enough. However, in the case of people with kidney problems, these high doses can increase the risk of cyanide accumulation. If you follow a special diet due to kidney problems, vitamin B12 is essential to avoid complications such as anemia or vascular problems. However, it is crucial to choose the correct form of the supplement, methylcobalamin, and maintain the appropriate dose. Number 4. Vitamin A. Now let's talk about another vitamin that can be even more dangerous for the kidneys, vitamin A. Although it is essential for health, consuming this vitamin in excess can be harmful, especially for those suffering from chronic kidney disease. The danger of vitamin A for people with kidney disease. When the kidneys are damaged, they cannot filter excess vitamin A from the body. This can lead to the accumulation of this vitamin, making it toxic. Among the problems caused by high levels of vitamin A are liver damage, congenital defects in pregnant women, and worsening of kidney disease. Additionally, consuming large amounts of vitamin A-rich foods, such as fish liver, can also cause problems. Although rare, excessive consumption of these foods can lead to acute kidney injuries and even hospitalization. Many multivitamins contain doses of vitamin A that are not safe for people with kidney problems. As this vitamin accumulates in the body over time, it is crucial to monitor its intake. This helps prevent toxicity and protects the kidneys from additional damage. Vitamin A is essential for health, but it should be consumed with great care, especially by those with kidney problems. Excessive doses can cause serious health damage and accelerate kidney impairment. Number 5. Vitamin C. Now we come to the vitamin that tops the list of the most risky for people with kidney problems, vitamin C. It is widely known for its benefits, but in excess, it can be extremely harmful. Remember the story of the 55-year-old woman with worsened kidney failure? One of the reasons for the worsening of her condition was the excess of vitamin C. She was taking 1,000 milligrams of ascorbic acid, another name for vitamin C, daily, believing it was strengthening her immune system. Doctors discovered that the problem was not just the dose, but her kidney's inability to eliminate the excess vitamin C. This led to the formation of oxalate crystals in the kidneys, which can cause severe injuries. This condition required emergency medical intervention. Although vitamin C is a powerful antioxidant and helps in iron absorption and immune system strengthening, its excessive consumption can be toxic, especially for those with chronic kidney disease. High doses overload the kidneys, potentially causing oxalate crystal accumulation and permanent kidney damage. What do we learn from this? Vitamins are important, but their incorrect use can be dangerous. People with health problems, especially kidney issues, need to be extra careful with supplements. Always consult a healthcare professional before starting to take any vitamin or supplement. Even though they are sold without a prescription, vitamin supplements are not risk-free. It is essential to know the safe consumption limits and watch for possible adverse effects. If something seems wrong, seek medical advice. Did you like this dose of health video? Share this information with friends or family members who have kidney disease. With knowledge and caution, it is possible to avoid serious complications and protect your health. Being informed is always the best path. Stay with us and watch one of the suggested videos appearing on your screen right now.